So toxicity is any unwanted side effect of any of our medications that we use to treat patients. And in particular with colorectal patients, we're thinking about the types of problems that our patients have in response to chemotherapy, either when they're having the infusion itself or in the days following. And the problems that most people talk about are either related to the gastrointestinal tract, like diarrhea, nausea, constipation, or peripheral neuropathy, if they're on oxaliplatin. But it can also be things that the doctor has to check for, like blood test results, that patients might not even notice is wrong.
The main way is to try and prevent the toxicity from occurring in the first place, and all of the treating doctors will be trying very hard to do that. The other way it's managed is obviously to treat the symptoms as they occur. And one of the important things for patients is to make sure that their caring team are aware of what symptoms that they are having, so that they're able to address those. Then it depends on what the actual symptom is. So it may be occurring during treatment, such as nausea and vomiting, and we now have very good medication that's able to control that. It may be problems with nerve damage from some of the chemotherapies that are used that can occur longer term, or it may be things like mouth ulcers, and again we have good treatment to be able to manage that. So one of the things that we're interested in is, I'm director of the Sydney Survivorship Centre at Concord Hospital, and we see people that have had earlier stage disease but after they've finished their chemotherapy. And what we've noticed is very high rates of some of these symptoms that continue, and so we're particularly looking at trying to both prevent but to try and manage those symptoms longer term. So in the case of one of the studies that we're about to start, what we're looking at is to try and see whether we can improve the management of the damage to the little nerves in the fingers and the toes. And although that sounds like it's not a big deal, it can be a major problem for people and long lasting. And it's actually the major cause of stopping one of the chemotherapy drugs, which is quite effective, but having to stop it early. So if we can find a way to decrease the longer term impact, it would mean that there would be less having to reduce the dose of particular chemotherapy.
Okay, so the OXTOX trial is looking to see whether we can use oral medication, which is a tablet, to prevent some of the nerve toxicity side effects from oxaliplatin, which is a medication that people often use to treat colorectal cancers. So the way that we're doing it is for patients to either have a placebo medication or the investigation drug, which is called ibudilast, throughout the time of their chemotherapy treatment. We really hope that it can help to prevent or reduce the severity of the neuropathy symptoms, because they can be really troubling to patients and affect their quality of life.
So this study is for people that have colorectal cancer, and in this case it's metastatic colorectal cancer, so that's more advanced colorectal cancer, and that are going to be starting oxaliplatin. So they can't already be on it, and they can't have had it within the previous 6 months of treatment. And so they also can't already have damage to the nerves from another cause, such as it can occur with people who have diabetes, for example.